Yeah, Rainer Hoyn. I'm professor of psychiatry and editor of European Psychiatry, editor of, editor of Global Psychiatry Archives. And I wanted to present one of the papers we published a while ago, and it's about pharmacotherapy, prescribing in the treatment of bipolar disorder in South African specialist population. So this is a study which was published by Eleanor, Holzapfel, and Christopher Szabo. The idea was to find out which treatments were given to patients with bipolar disorder and whether this is in line with other countries. So the study objectives were to describe the frequency and type of psychotropics used in management of bipolar disorder. So this was a study which was confirmed done in Tara Hospital, outpatient clinic. It's a specialized secondary therapy and quarterly specialist service. And the question was, how often is polypharmacy a common issue, or is it more monotherapy? And polypharmacy was seen if it's more than 2 different medications. So they did a scan, and this is a type of a scan. They looked at all patients which were seen in 1 year, and they screened a couple of years later. We don't know why. So they looked for all patients who had a diagnosis of bipolar disorder, and every patient who was bipolar disorder was reviewed in the study. The sample consisted of a quite normal mixture of people concerning age between 18 and 65, less male than females, which is quite common, and there are different types of funding. So the question is, what were the therapies given? There were lots of people with bipolar 1 and bipolar 2. More or less, most of them is bipolar 1, and this is giving the table of medications that were given. It's lots of lithium, nearly 35–40%. Antipsychotics, typical antipsychotics, some antidepressants. So let's assume that not all patients. So anticonvulsants, antipsychotics, antidepressants, medications. Some SSRIs, tricyclic antidepressants. So, and looking at polypharmacy, there was a minority of people who just one antipsychotic, and there were even more who had more than 5 different medication types, which seems to be reflecting the fact that there are quite severe patients in this setting. Right, so they have different diagnoses, little monotherapy, 6%, 93%, or 94%. Polypharmacy, and the medication was a number of medications. So this gives into classes of medication prescribed. And what's evident is different classes of medication. So it seems to be that not 2 antipsychotics, but antipsychotics, antidepressants, lithium, and mood stabilizer have been prescribed at the same time. Right. And the results simply say more or less that the findings is that only half of the people are prescribed according to normal guidelines, and majority of certain patients were, this is coming to the conclusions. I don't want to go into all details, but I want to give some ideas. Lots of combinations, so the mean of the number of different classes of medications are 2.8, which is quite a lot. And this study is in South Africa, and what can you see that most what they found in this study is more or less what they found in other countries, and that not all patients are treated according to guidelines. It seems lots of patients have combinations, and this reflects the fact that there are very few guidelines and very few studies which have been looked at all the medication at the same time. And it seems that, different doctors more or less have found that they have to do what's practical and have to do what's in their best knowledge, but guidelines are missing on this. Okay, if you're interested in that, please check our website, www.globalpsychiatry.co.uk.